Welcome to Bloodborne Pathogens Training, OH218, at the University of Texas at Austin, Environmental Health and Safety. Bloodborne pathogens training is required for personnel who may be exposed to bloodborne pathogens. This includes, but is not limited to, researchers and various laboratory employees, healthcare workers, first responders, and certain custodial staff. The training is required initially. There is a requirement also for an annual refresher. Whenever new tasks are assigned, then training should be performed again, and all of this training should be documented. Bloodborne pathogens are disease-causing agents that are found in human body fluids and tissues, and also in non-human primate body fluids and tissues. Blood is the primary body fluid of concern. Other body fluids that can contain bloodborne pathogens are vaginal secretions, seminal fluid, unfixed tissues, and also human cell lines. Human cell lines have the potential for being contaminated with latent viruses, hepatitis B, and mycoplasma. Keep in mind that not all body fluids are considered to be high risk for bloodborne disease. Body fluids such as saliva, urine, and vomit are considered to be very low risk unless they're visibly contaminated with blood. Most bloodborne pathogen exposures which occur in the United States are from contact with blood. There's approximately 600 to 800,000 exposures each year. There are three basic routes of transmission. The first is dermal, where the contaminated material comes in contact with your blood through an open sore or break in the skin. This can be due to a wound or a condition such as dermatitis or poison ivy. Another route of transmission is when contaminated material is splashed into the mucous membranes of either the eyes, the nose, or the mouth. And the last way is through a puncture wound. Typically, this is through contaminated needles or other sharp instruments such as scalpel blades or razor blades or syringes. The bloodborne pathogens of primary concern are hepatitis B and hepatitis C, and also the human immunodeficiency virus. There are other disease-causing agents and other diseases that can be transmitted through contact with blood, such as syphilis, malaria, Lyme disease, prions, and the Ebola virus. For this training, we will be focusing on hepatitis B and C, and also on the human immunodeficiency virus. Let's start with hepatitis. Hepatitis is a term which means inflammation of the liver. There are many different types of hepatitis. For example, hepatitis A is not transmitted through blood, but rather it's normally associated with foodborne outbreaks. As far as bloodborne pathogens, we will focus on hepatitis B and hepatitis C. Both of these attack and replicate in the liver cells and can lead to serious liver diseases. Hepatitis B is the most common. There are two different ways that the disease can progress. The first is a self-limited acute hepatitis, and the second is a chronic hepatitis B infection. Let's look a little more closely at hepatitis B. The common symptoms are going to be jaundice or yellowing of the skin, anorexia, nausea, arthritis, rash, and fever. Carriers of hepatitis B virus may not have any symptoms initially, yet they can transmit this virus to other people. There is a risk of chronic liver disease and liver failure as they age. For hepatitis B, there is a vaccine to help prevent infection. For more information about hepatitis B, please click on the link to access information on the CDC website. If you are at risk for occupational exposure to bloodborne pathogens, then your employer is responsible for providing you the hepatitis B vaccine free of charge. If you work at University Health Services, you can arrange the vaccine through your supervisor. For most other university employees, contact HealthPoint. HealthPoint is in the Student Services building. If you work at UT Health Austin, you can receive your hepatitis B vaccine at the Work Life Clinic. You have the option of declining the vaccine, and if you do decline, you can change your mind and receive the vaccine at any time in the future. The vaccine is a series of 3 shots over 6 months, and 96% of people that are vaccinated will be protected. Let's look at hepatitis C. Hepatitis C has an incubation period of approximately 2 to 22 weeks, with an average of about 10 weeks. Typically, you will see mild flu-like symptoms. With hepatitis C, approximately half of the people infected will develop a chronic hepatitis disease. Liver cancer can develop later on in life. There is no vaccine available for hepatitis C. For more information on hepatitis C, you can look at the CDC website. There are 2 different strains of the HIV or human immunodeficiency virus, strains 1 and 2. The more common strain in the United States is HIV-1. HIV attacks your body's immune system and is found in all tissues. HIV infection may lead to the acquired immunodeficiency syndrome, otherwise known as AIDS. There is no vaccine available for HIV. There are, however, antiviral medications which help manage the HIV infection, and there is no cure. There are many symptoms for someone that has AIDS, such as severe weight loss, diarrhea, weakness, fever, neurological disorders, and opportunistic infections. Since the body's immune system is compromised, it's very easy for someone that's positive for HIV to be infected with other secondary or opportunistic infections. For more information on HIV infection, please look at the CDC website. The exposure risks for HIV and for hepatitis B and C do differ. HIV is able to survive or remain viable or able to cause infection on a surface for several hours if it's dry, and it may survive for up to weeks if it's in a more protected wet environment, such as in a used needle or syringe. Hepatitis B and hepatitis C are more of a concern because they are able to remain viable or able to cause infection on dry surfaces for a much longer period of time, possibly for weeks. Hepatitis B and C are also more resistant to chemical disinfectants than HIV, and also tend to be more concentrated. In 1 milliliter of blood, there may be up to 100 million viruses. So the risk of transmission from a contaminated needle varies quite a bit between HIV, HCV, and HBV. If you're stuck with a needle that's contaminated with HIV, the chance of you actually becoming infected with that single exposure is less than 1%. With HCV, it's a little over 1%, and with hepatitis B, the risk of becoming infected due to that single exposure is approximately 30%. There are many different standards and rules which apply to employees that have occupational exposure to bloodborne pathogens. One thing to review is the universal precautions through the Centers for Disease Control. On the slide, click on Universal Precautions to learn more information. Basically, what universal precautions means is that every time that you have potential exposure to bloodborne pathogens, such as blood or human unfixed tissue, you need to work assuming that those materials are infectious that they do contain bloodborne pathogens such as hepatitis B and HIV, and always take precautions. The Occupational Safety and Health Administration, or OSHA, has a federal regulation for bloodborne pathogens. The state of Texas also has a bloodborne pathogen law, which is found at the Texas Administrative Code, Title 25, Chapter 96. The CDC and the NIH jointly publish a document called Biosafety in Microbiological and Biomedical Laboratories. That document outlines the procedures that lab personnel should follow while working with bloodborne pathogens. And then lastly, at the University of Texas at Austin, there is a bloodborne pathogens written exposure control plan. This plan is written primarily through environmental health and safety and also through a university bloodborne pathogen committee. To view more information on the plan and also on the regulations and rules, please click on the hyperlinks shown on the slide. All university employees that have occupational exposure to bloodborne pathogens need to be familiar with the university's written exposure control plan. In laboratories, there's additional requirements for a written biosafety manual. If you have any questions about the exposure control plan or need any type of assistance in developing your lab's biosafety plan, please contact Environmental Health and Safety. Engineering controls and work practices help to reduce your exposure by either removing the hazard or by isolating you from the exposure. If you work in a laboratory environment, be sure to follow the CDC NIH Biosafety Level 2 requirements and also follow universal precautions. Wherever possible, substitute plastic for glass. Try to eliminate the use of glass as much as possible to help prevent puncture wounds. Use safe, sharp devices such as needles that have safety engineered features that make them less likely to cause a puncture wound, or retractable scalpels or coated capillary tubes. Never consume personal food or beverage in your lab or work area where bloodborne pathogen contaminated materials may be present, and don't store your personal food or beverages in refrigerators or freezers where bloodborne pathogen contaminated materials may be stored. Be extremely cautious whenever handling sharps. Never recap, bend, or remove used needles from syringes. The needle and syringe unit should just go directly into a sharps container as soon as you're done using it. Sharps containers cannot be overfilled. Be sure that you submit a request for disposal form to Environmental Health and Safety when the container is getting approximately 3/4 full. Keep the sharps container as close as possible to your work area where you're using the sharps. For more information on safe handling of needle devices, you can visit the National Institute of Occupational Safety and Health website. If you must recap a needle for some reason, then the CDC does allow this one-handed recapping method. As you can see on the slide, it shows the cap being placed up against something and then using one hand to push the needle into the cap. This should only be done if absolutely necessary and only with non-contaminated needles. Never pick up broken glass directly with your hands. Make sure that you have tongs, cardboard, a scoop, or a broom available. Contaminated glass needs to go into your red plastic sharps container. Hand washing is a very important part of universal precautions. Make sure that you thoroughly wash your hands with soap and water after removing gloves, before you leave the work area, and after you've had contact with contaminated material. If bloodborne pathogen contaminated material gets splashed into your eyes, make sure to thoroughly rinse the eyes with your eye wash for several minutes. Personal protective equipment or clothing needs to be worn whenever you're working with bloodborne contaminated materials. The clothing will depend on the work that you're doing, but at a minimum, you need to be wearing gloves. A face shield is necessary if you believe that your work may result in splash of contaminated material to your face. Lab coats should be worn, and consider that these materials should be impermeable. In other words, it shouldn't allow the blood to transfer to the inside of it. Most of your protective clothing will be reusable, such as the lab coat and safety glasses. Some will be disposable, such as your gloves. Gloves are generally intended for single use only. After use, discard them. All your protective clothing should be kept in the lab or in your work area. This clothing should never be worn to other areas such as break rooms, restrooms, or other areas where you could be spreading contamination. Make sure that your lab or your work area has a written procedure on how to disinfect work surfaces and how to manage your waste and how to clean up spills. You need to have an appropriate disinfectant that's going to be effective against bloodborne pathogens. The CDC recommends a disinfectant that's been registered with the EPA. This means that on the label it will actually say EPA and will show a registration number. It needs to also say on the label that it's either a hospital disinfectant or a hospital cleaner and that it is effective against the hepatitis virus. Alternatively, you can make a fresh solution of a 1 to 10 bleach solution with water. If you use bleach, you should make the solution daily. That's 1 part bleach to 10 parts water. You can also use plastic backed paper to protect work surfaces. The plastic should prevent the spill from contaminating the work surface beneath it and should also help prevent splatter and splashes. But keep in mind that lab bench paper should be removed daily so that you can, once a day, wipe down the work surface with an appropriate disinfectant. The bloodborne pathogen rules and standards require that all waste containers and other containers that are used to store, ship, or transport blood or other potentially infectious materials be labeled appropriately. So be sure to label these containers as well as any equipment that may be contaminated. For example, centrifuges, refrigerators, freezers. These labels are available from Environmental Health and Safety. All waste and contaminated items need to be kept in closed containers. Sharps go into the red plastic sharps containers that are provided by and disposed of through Environmental Health and Safety. You can autoclave waste yourself. If you choose to do so, follow the Environmental Health and Safety procedures. Or you can have Environmental Health and Safety pick up your biological waste. We will provide the necessary biohazard bags and boxes. Alternatively, you can use a chemical disinfectant to treat some of your liquid waste. There are procedures for that on the Environmental Health and Safety website. Make sure to follow those procedures appropriately. Follow your department or your lab-specific procedures for dealing with biological spills. Make sure that you always first put on your personal protective equipment. Cover the contaminated area with an appropriate disinfectant and allow a 20-minute contact time. After the appropriate contact time, remove the contaminated material through the use of rags or paper towels. All of the materials that were used to clean up the biological spill will be considered biohazardous waste and needs to be treated either through autoclaving or by pickup through Environmental Health and Safety. As needed, consult Environmental Health and Safety for spill cleanup response or assistance or advice. If you have a bloodborne pathogen exposure, make sure to thoroughly wash the area with soap and water. Contact your supervisor. Also contact Health Point Occupational Health Program, or if it's after hours, a healthcare provider which is experienced in post-exposure procedures. Also contact Environmental Health and Safety at 512-471-3511. The post-exposure medical follow-up will include testing for Hepatitis B, Hepatitis C, and HIV, and possibly other bloodborne pathogens. Antiviral medication options will be discussed with the patient, and testing will need to continue for approximately 6 months. UT Health Austin employees should contact the Work Life Clinic in the Health Transformation Building if they have an exposure. For most employees, post-exposure care is managed through HealthPoint, the occupational health program, in the Student Services building. They also manage the lab animal and biomedical occupational health services. They're located on the 3rd floor, and their phone number is 512-471-4647. UT Health Austin employees would report for post-exposure care to the work-life clinic in the Health Transformation Building. Research projects at the university are reviewed to determine occupational and environmental hazards, including those projects that involve bloodborne pathogens. There is an institutional biosafety committee that will review the project through the use of a biosafety form, and environmental health and safety performs laboratory evaluations for the labs that do work with bloodborne pathogens. When transporting materials on campus that may contain bloodborne pathogens, do not use public transportation such as buses or riding on passenger elevators wherever possible. Do use a sealed plastic leak-proof containers that are closed, and also use biohazard labels on these containers to identify it as an infectious material. When shipping off-campus materials that may contain bloodborne pathogens, keep in mind that these materials are likely to be regulated as a hazardous material through the Department of Transportation. The person doing the shipping needs to be a certified shipper. In order to be certified, there's special training requirements. Environmental health and safety can assist with providing this training and also can provide shipment services. There are certain record-keeping requirements through the bloodborne pathogen standards and rules. Be sure that your lab, healthcare setting, or departmental procedures and emergency plans are available. The annual and refresher bloodborne pathogen training will be documented in the university text class database, and exposure reports will be maintained through environmental health and safety and occupational health program. If you have questions or would like to learn more about bloodborne pathogen procedures, please talk to the instructor following the class. If you're taking this training online, you can contact Environmental Health and Safety through the website or call 512-471-3511. Environmental Health and Safety does provide services 24 hours a day, so if you have an emergency after hours, do not hesitate to call. If you have questions about occupational health services, including how to schedule your hepatitis B vaccine, contact the Occupational Health Program website or call the Occupational Health phone at 512-471-4647. UT Health Austin employees should contact the Work Life Clinic at 512-495-5900 for questions or to schedule your hepatitis B vaccine.